Coronavirus cases are on the rise here in the U.S. The CDC is reporting a 10% increase from last week and estimates a quarter of those cases are due to the Delta variant. CDC Director Dr. Rochelle Walensky warns that communities, largely in the Southeast and Midwest, are most vulnerable, and it's due to their low vaccination rates. David Begnaud reports from Arkansas.
The rising numbers are driven in part by spikes in new cases across the South. Arkansas just saw its highest one-day spike since February.
People who are unvaccinated are at significant risk of a virus that spreads so efficiently.
With that Delta variant now present in all 50 states, Dr. Anthony Fauci says it is highly contagious for parents and their children.
Please get vaccinated because we have a highly effective countermeasure against this Delta variant.
Nationwide, barely 1 in 5 12 to 15-year-olds are fully vaccinated. And with school in some states opening next month, this week marks the critical deadline for parents to vaccinate their eligible kids. It takes 5 weeks to be fully vaccinated with Pfizer's shot, and that is the only one authorized for people as young as 12.
If we, want to end this pandemic, the children need to get vaccinated also.
Nico and Sophia Chavez are part of a Pfizer trial that's testing the vaccine on children 5 to 11.
All done. That's it. That's it.
People say, well, the children don't get that sick. They're not as infectious as others. But in fact, this disease has caused more deaths in children than the flu does.
Here in Calhoun County, Arkansas, the vaccination rate is among the lowest in the state. Victoria Carmier works at the town feed store and says she's had people buying a gel meant for deworming horses that they're using to treat COVID. So they'll take a horse gel.
Yes, and put it on a cracker.
And put it on a cracker, but they won't take a vaccine that's undergone clinical trials.
Right, ain't that crazy?
She's talking about ivermectin. It's meant for horses, not humans. Humans have tried it and they wound up in the hospital. So the FDA warns, don't do it. Lana?
David, an important warning. Thank you. For more, let's bring in emergency medicine physician, Dr. Anand Swaminathan. Dr. Swaminathan, always good to see you. But I got to be honest, I'm shaking my head that we're talking about rising COVID rates again. I imagine you're feeling the same way. Obviously, the Delta variant is fueling surges around the globe, even in countries like South Korea and Israel, which just weeks ago seemed to have gotten a handle on the virus. So how much damage could this strain cause globally, and particularly here in those pockets of the U.S. that are less vaccinated?
Well, Lana, I think around the world, we're going to see a very similar thing to what we're seeing in the U.S. There are countries with high vaccination rates where Delta is going to cause some spikes in cases, but not in hospitalization, not in deaths. That's what we know. We know that if you have your full vaccination done, you're very protected, not just against getting any form of Delta, any severity, but you're very protected against hospitalization and death, and that's the key. So we might see a couple of cases or some rises in cases in places like Israel, but we're not going to see a huge impact of Delta there because they're fully vaccinated. And we're seeing the same thing in the U.S. We're seeing areas where this virus, this variant, is going to really tear through communities because those vaccination rates are so low, under 30%. We're talking about the country being around 50%, but there are pockets that are 25, 30%, and that's where Delta is really going to take off. And that's why we have to be careful here. We talk about recommendations and what we should be doing for public health measures. That really has to be determined on your local community and the prevalence of the disease, as well as the vaccination rates. So where I am in New Jersey, our vaccination rates are very high overall. We're not seeing spikes. We're continuing to see declines in cases. Meanwhile, places like Arkansas, Missouri, Nebraska, Oklahoma, we're seeing massive rises in cases. Hospitals in that area are already overwhelmed. And while deaths haven't risen yet, we know that lags. That takes time before we see the deaths rise.
Right. The cases come first, the rising case numbers, and then the rising death numbers. As you mentioned, the U.S., though, is really divided in its vaccination efforts, and that these areas with lower vaccination rates are more vulnerable to the Delta variant. But given that, what kind of approach do you think is needed to try and get this new strain under control?
Well, I think there's two different things that we can do right now. One is obviously to get vaccinated. We discussed how long that takes. It takes about 5 weeks, 6 weeks before you are fully vaccinated, which means that anybody who is on the fence needs to go and get that first shot now so they are protected as soon as possible. There is no time to delay for that. If you're not getting vaccinated, or if you're in a community where vaccination rates are low, then you need to go back to the public health measures. Distancing, masking, not being indoors with people you don't know. I think that those restrictions are what can continue to protect those who aren't vaccinated. The problem, of course, is that a lot of the areas where vaccination rates are low are also areas where public health measures were never really widely uptaken. And so people really need to understand what's going on, what the limitations are of what they can do based on that vaccination rate. This is a really dangerous time, even for people who are fully vaccinated in some of these areas. I think the things that we can do, one, obviously, is get vaccinated. Two is to talk to your family and friends. If you're vaccinated, talk to your family and friends about why you chose to get vaccinated and why that's important. We know that messaging from other colleagues, from friends, from family can help to convince people to do this. And those are really the best ways that we can protect each other as well as ourselves.
So you brought up masking, and I want to ask you about mask guidance, because Dr. Fauci says, despite the World Health Organization's recommendations, that it doesn't look like we need to change the recommendation in the United States that vaccinated people do not need to mask up in most cases. But do you believe that we might see new restrictions, and under what conditions?
Well, I think, again, we can see new restrictions, and they can be very regionalized as to what's the best for that community based on vaccination rates. And I think Dr. Fauci is right here because, I mean, he's always been right a lot of times, obviously. He's right here again because the WHO is really talking about guidelines for an entire world that is mostly unvaccinated. We're talking about more of restrictions that should apply to our population where vaccination rates are a little bit better. But again, Dr. Walensky, Dr. Fauci have both said this is going to be very individualized, and local public health are going to have to really look at this and say, what's going on in our community and what's best for our community. I think it still is reasonable to mask indoors, even if you're fully vaccinated. And I think in those places where vaccination rates are low, it's going to be really important to continue to mask to avoid crowds, because that's where this is going to be transmitted. And when we look at Delta being 60% or more transmissible than some of the prior variants, it's really important for us to take those precautions into account.
So given the concerns about the Delta variant and that we're coming up on another holiday weekend, what kind of celebrations would you consider safe? What types of precautions should people keep in mind? And I'm thinking in particular about people who have children who are younger, who have not yet been able to become vaccinated, or who may have received only one dose. What types of advice do you have for those different groups?
Yeah, and this is something that we've spent a lot of time talking about in my household, my community. We have 2 young children who haven't been vaccinated. We have 1 who has been vaccinated. Everything should be outdoors. I mean, that is really the best answer. If you're going to have a gathering, do it outdoors. If you're outdoors and you can't really maintain some bit of distance, wear a mask. If you have to go in to use the bathroom at whoever's house you're at, put a mask on. I mean, these are simple things that we can do to really help to stop the spread of Delta. And again, you're going to have to know what the local rates are. There are communities where the vaccination rate amongst adults is considerably high enough to protect children who are unvaccinated. That doesn't mean that you should put a bunch of 4-year-olds in a room together because most of the adults are vaccinated. I'm not saying that. But there is an amount of protection that is granted by all of the adults around those kids being vaccinated to help almost to form a little bit of a bubble. But I think that the best thing we can do right now with this holiday weekend is stay outdoors as much as possible if you're going to be in a gathering. That is the safest thing for us to do right now.
And that advice, you think, also holds for people who have been fully vaccinated?
I think it's probably best. I think it is probably best to spend that time outdoors. I mean, listen, if you're in a small group of adults and you know that everybody has been vaccinated, you want to do something indoors, I think that is a relatively safe thing to do. But the question is, do you know that everyone's vaccinated? Do you know that people have been careful about their travel, et cetera? I think there's a lot of ifs in there that you need to know about. But yeah, if you can get together with family where everyone's been vaccinated, go ahead, go indoors, do something together, because you've earned that by getting vaccinated. Otherwise, though, if you're in a group where it's mixed, you're not sure who's vaccinated, who isn't, stay outdoors.
All right. Dr. Anand Swaminathan, thank you for joining us, and thank you for all that you do.
Thank you.